A day after the U.S. authorized second booster shots for those over age 50, President Joe Biden rolled up his sleeve and made a fresh pitch to Americans.
We're now in a new moment in this pandemic. Does not mean that COVID-19 is over. It means that COVID-19 no longer controls our lives. That's what it means.
Fourth shots are now seen as the best defense for older and more vulnerable people. In the U.S., they're rolling out at a confusing time. Case numbers have plummeted. Hospitalizations are at their lowest point in 2 years.
It's hard to tell people that doing something now is really going to help you weeks, months, maybe even years down the line.
There's reason for concern. The Omicron BA.2 subvariant is now dominant in the U.S., and cases are starting to tick back up. Yet millions remain vulnerable, undeterred by the nearly 1 million pandemic deaths to date. Today, less than 70% of eligible Americans are fully vaccinated with 2 doses, and only 46.5% have received a booster dose.
This really does beg the question, where should we focus our limited resources? Is it on providing 4th doses, or is it on other measures, for example, making sure we vaccinate people who may not have even had a single dose yet?
At the same time, the once world-leading U.S. response has effectively run dry. Congress has not approved funding to cover the cost of future COVID testing, treatment, or vaccine doses.
Congress has to provide the funding America needs to continue to fight COVID-19.
Yet it may be tough to convince Americans to keep up the fight. 2 years in, and during a welcome reprieve in cases, many feel like they're done with the pandemic, even if it's not done with them. Jackson Proskow, Global News, Washington.